Our next speaker is Professor Lucie Rychetnik. She is co-director of the Australian Prevention Partnership Centre and professor at the School of Public Health at the University of Sydney. She has over 30 years' experience in translating research and mobilising knowledge for public health policy and practice. And she's also a board director of the Australian Climate and Health Alliance. Welcome, Lucie, and thank you.
Thank you so much, and good afternoon, everyone. It's a real pleasure to be here. I'm joining you from Dharawal country in the beautiful northern Illawarra, and I'd like to acknowledge the traditional owners of this land and pay my respects to the elders past, present and emerging. I will also turn off my video just while I go through my presentation because I think I've got slightly jumpy Wi-Fi, and then I'll rejoin again when it comes to the discussion. So I'm going to be talking about the co-benefits of chronic disease prevention in the time of climate change. And as Yvonne said, I'm from the Australian Prevention Partnership Centre, which is the sister partnership centre organisation. There was a number that were funded. And we focus on chronic disease prevention, taking a systems approach. So it builds really nicely on some of the things that Nari was just saying. So why chronic disease? Chronic disease is a major problem in Australia. So by chronic conditions, we're referring to things like cancer and respiratory disease, heart disease, diabetes, poor mental health. So things that last a long time and that impact on people's health and well-being. And chronic diseases cause up to 8 out of 10 every premature deaths. And they also account for about 80% of the years that are lost due to ill health, disability or early death. So while Australians may be living longer, they are actually getting sicker in the sense that they're living longer but in poorer health. And chronic conditions also make you incredibly susceptible to other things like the coronavirus pandemic, as we've shown, with people with underlying chronic conditions much more susceptible to ill health and death. People who are also disadvantaged and poor suffer greater rates of chronic disease. A lot of chronic disease is preventable, and you can see here some of the risk factors that we often focus on when we talk about chronic disease. Tobacco, overweight, high or dietary risks, high blood pressure and alcohol use. And up to the burden of disease study demonstrates that up to nearly 40% of chronic disease is preventable if we were to address these risk factors. However, decades of public health research and evidence demonstrates that those risk factors sit within a much broader system. And as you can see, behaviours are there in the dark blue box, but there are many other factors that impact on risk factors such as tobacco use or overweight and obesity. And chronic diseases are the drivers of chronic disease, as we've already mentioned, some of the social determinants of health. So occupation, the security of income, people's education, their status and social position, which sits within a much broader policy and political and social economic environment. So I think that systems approach is incredibly important to acknowledge, and that just telling people what to do is never going to work. So what about climate change? So we've already heard about the impacts of climate change on health. And here you can see some of the direct effects that have already been mentioned of extreme heat and bushfires, drought and floods, and some of the indirect effects impacting on water quality and food safety and air quality. And you can see that climate change is also interacting with many of those social determinants of health. So impacting on food security, impacting on people's income, it can impact on people's housing. And there are also interactions in the sense that people who live in poorly insulated housing are much more susceptible to heat, or if they can't afford to run their air conditioning or put in solar to be able to run that air conditioning off solar. So you can see that there are many interactions in this system between the impacts of climate change and chronic disease. And of course, some of those direct effects also have a greater impact on people who also already have underlying chronic conditions. So co-benefits, what do we mean by co-benefits? So what we're talking about here are multiple positive outcomes that can occur with a systems change. So this diagram was originally put forward by the Bicycle Innovation Club promoting cycling. And the idea here that we're trying to promote the transport modes that are at the top and reduce the ones that are at the bottom. And that shift towards more public transport, car sharing, and using bicycles, creating environments and communities where workplaces and food stores are closer so that people can cycle or walk. There can be many benefits from that. And those benefits can be on the emissions, greenhouse gas emissions. The benefits can be in the form of reduced air pollution. You might be thinking in terms of reduced congestion, but also promoting physical activity and active travel. And some of the co-benefits of acting on climate change have been nicely articulated in this example from Victorian government, providing guidance for local government about how to tackle climate change and the co-benefits on health and other outcomes. So you can see at the bottom some of the interventions that are being recommended on the bottom left, like using renewable energy and promoting active transport, putting in green spaces, and all the different health outcomes, the health benefits that can be created by creating these healthy systems and environments. And the co-benefits listed there on the bottom right. So using fewer fossil fuels, improving air quality, lowering emissions. So just a few examples in a bit more detail. So this is from some work that some colleagues with the Prevention Centre have put together, looking at some of the best buys of preventive interventions in an urban environment. So looking at increasing the walkability and improving active transport and infrastructure and investing in those in a community can have impacts for health and well-being, for economy, environmental co-benefits and other co-benefits. So the health benefits, again, being increased physical activity, improving the quality of life and reducing the prevalence of respiratory conditions. Also economic benefits and reducing environmental benefits like reducing CO2. So just one final example, increasing the provision of urban green space. So for example, including tree canopies, again, impacting on health and well-being, such as improving mental health and well-being and reducing mental distress, improving opportunities for physical activity, economic and environmental and other outcomes, so increasing the amenity and the value of the green space, reducing heat and mitigating the heat island effect that occurs in large cities, and providing opportunities for greater social connection in local parks or local green spaces within smaller communities. So another way of thinking about co-benefits, this is an example from the Lancet Commission on Obesity, Undernutrition and Climate Change, led by Boyd Swinburne from New Zealand. And the Lancet Commission set out to look at a systems approach for addressing chronic disease and overweight and obesity on a global level. But when they started to look and take a systems approach, they started to identify that, in fact, the drivers of overweight and obesity and chronic disease were very similar to some of the drivers that were causing undernutrition and also that were causing climate change. And so they started to put together this idea of a triple duty action or multi-duty. Some of them were double duty and some were triple duty. So these were actions that if you implement will have benefits across all three. And so there was basically the message of this work was that there are common drivers, but there are also these common solutions. So again, looking at shifts in transport through infrastructure, tax and subsidies, social marketing strategies can actually impact on physical activity and less sedentary time. It can create cheaper transport and better access to healthy food and employment for people. And it can also lower greenhouse gas emissions from transportation. Another very important triple duty action that was identified in this work was the importance of restricting commercial influences. So basically what they were saying was that we need more transparent management of conflicts of interest and in political funding. And the triple duty benefits here was that it would reduce the opposition to food policies for addressing overweight and obesity and chronic disease. It would reduce corruption and more poverty reduction, and it would also reduce political opposition to policies around greenhouse gas emissions. So what about tobacco control policy in Australia as an example? And I think the key message really here is that we need strategic and targeted policy, regulation and laws to have effective chronic disease prevention. And we also need that to have effective climate change action. So this is just an example, a very successful example from chronic disease prevention in relation to tobacco control policy in Australia. And as you can see here, we've got actually one of the most successful tobacco control policies globally, as I mentioned. And it wasn't any one thing. It was very much a systems approach. And over time, our rates of smoking have significantly decreased. But you can see that it actually included bans on advertising in print media, warnings on packs, point of sale advertising bans, excise rise, so increasing taxes. It also included the plain packaging laws more recently and larger health warnings. So you can see that there were many variables and many factors that contributed to this, and we've been very successful in reducing the influence of the tobacco industry on public policy. This is another example, and this is from the Obesity Policy Coalition. So 8 critical actions that Australia must take to tackle obesity. And I would say that we've been maybe less successful here. There are very important system-wide changes that are required. The evidence shows that they're very effective, but to date, we really haven't been that successful at getting those implemented. So particularly things like adding a levy on sugary drinks or toughening restrictions on TV junk food advertising to kids. Industry is self-regulating. And basically, we still have quite strong influence on public policy by these industries. So what about climate change? So if you look at greenhouse gas emissions by sector, as we know, most of the emissions are coming from the energy sector and the transport sector from the burning of fossil fuels. And really what we know that we need to be implementing triple duty actions that have impact on reducing emissions, improving health, and also improving the economy. And I think, as Peter and others have already said, we do know what to do. The problem is that we haven't so far been managed to implement that in policy and practice, particularly at a federal level. So we really should be thinking of our interventions and our solutions as the co-benefits of the triple bottom line, where we can have benefits in terms of climate change impacts, in terms of health impacts, and benefits for the economy. So I would just like to mention the Climate and Health Alliance. I just recently completed a 3-year position on the board of the Alliance. They're an amazing organisation. For me personally, as a health professional, it's been an incredible experience to be part of this alliance. And they've just recently relaunched their new framework for a national strategy on climate, health and wellbeing for Australia called Healthy, Regenerative and Just. So the focus there is on environmental and climate change and environmental degradation, or reducing degradation, producing healthy solutions, so regenerative solutions, and also just solutions that address inequities. Of course, the primary solution there is in terms of phasing out fossil fuel-based energies and investing in renewable energy, but it's very much in terms of taken from that, the health sector's perspective. So just final few slides to conclude. The title of my talk is the co-benefits of chronic disease prevention in the time of climate change. But I would say it certainly could also have been the co-benefits of climate action in the time of chronic disease. Both are causing a huge burden and often have many of the common solutions. So I'd just like to conclude by just pointing out a couple of slides where we could potentially be thinking about redirecting some of our investments as a country. So investment in prevention and public health at the moment is less than 2% of the total health budget. So of the 2 billion or so a year that we spend on health services, we're actually spending less than 2% on chronic disease prevention. But we also know that chronic disease prevention happens, as I've said, outside of the health sector in many of the other sectors. But it's an incredibly tiny amount relative to the burden of disease that chronic disease is causing. We are, however, spending up to 10 billion a year on fossil fuel subsidies. So if you look at that, I would just like to maybe controversially propose that there's a way of rethinking our investments here. We could actually be spending up to 12 billion on chronic disease prevention. It certainly doesn't all have to be in the health sector. And shifting some money out of those fossil fuel subsidies and investing them in other ways. So my final slide, just to summarize, there are known solutions to prevent chronic disease and address climate change. Many of the most effective solutions are systems-wide and they need to occur at scale. Our national investments and subsidies are choices based on what we as society and our governments value. And I think articulating these shared goals and co-benefits can support really strategic alliances for more effective action. We wanted today to be solution focused, so I think this is definitely a way forward. And I'd just like to finish with a cartoon that I know many of you will have seen before, but I think it nicely captures the key message of today. So thank you, Yvonne, and I'll stop sharing.
Thank you so much, Lucie. That was fantastic, and clearly a systems approach is needed, and multiple systems need to be involved, not just the system. Thank you so much.